Hi, is it okay if I come in? Perfect. Hi, how are we doing today? Great. My name is Janet. I am going to be your nurse today. Can you just go ahead and state your name and date of birth while I wash my hands for 20 seconds? All right, nice to meet you, Miss Jones. I'm just gonna go ahead and match that name and date of birth to your name, wristband. But it looks like everything matches up, so you're all set. Again, my name is Janet. I'm going to be your nurse today. So I just have a few more questions before we actually get started. Do you have any allergies that I should know about? No? Anything like tape or chlorhexidine? No? Okay, perfect. And then do you have any pain today, just so we can get that out the way in case we need to, monitor you for that instead? No pain? Okay, that's always great to hear. Basically today we're going to be doing a cvad dressing. You probably don't know what that is, but it's basically a central venous access device. This goes on the left of your chest and eventually leads to your heart. So it's important that we actually clean it and keep it clean constantly. And we do this by changing it at least once every 7 days or once a week. By doing this, we prevent any infection or any cvad, central line associated bloodstream infection. Sorry, that's a mouthful. But yeah, aside from that, this procedure should be pretty painless and quick. And aside from that, we're all good to go. Do you have any questions? I see in your record that you've had this for a while, so you probably have had this before. You've had this change before? Okay, perfect. All right. Now going on into our actual procedure, I am now going to be wiping the table. Since I already wiped my hands, I'm just going to go ahead and put clean gloves on first. Has any family visited you today? Yeah? Oh, that's great to hear. It seems like your family visits you pretty often, so they must really love you. Taking my wipe, and I'm going to be wiping for 30 seconds. Making sure to also wipe the sides of this table. Okay, great. Now it's been 30 seconds. Dispose of the wipe and dispose of the gloves. Great. And actually, even though I wiped it for 30 seconds, I have to let it dry for about 2 minutes, as that's the wait time for this wipe specifically. But we're not going to do just anything. We're actually going to be taking off the dressing that you have on your chest right now. Before we get into that, I have a few more education points I would like to go over. You're probably wondering why you're forced to wear a mask today. It's actually to keep prevent contamination of the dressing. And of course, we don't want that just because it's so central to your body. And that's the same reason why I'm actually going to ask you to turn to your right. Again, we just don't want you breathing over your site and possibly contaminating the area. So you're going to go ahead and look to your right and actually keep looking right until I tell you the procedure is done or I tell you otherwise. Does that sound good? Perfect. Putting on a new set of clean gloves. I'm going to go ahead and take that dressing off. So the removal of the dressing actually is pretty painless, again, like I said. At most, you'd probably feel some tugging. But in case you do feel any pain, don't be afraid to let me know, and then we can assess it from there. But yeah, I'm going ahead and going to be taking it off for you. If only these gloves aren't giving me a hard time. Great. Let's go ahead and take off that dressing. Do you have any questions so far? Great. Go ahead and keep looking to your right. It's really important that you continue to face this way. Taking off the dressing. And then do you have any pain right now? You feeling okay? That's always good to hear, no pain. Okay. And then before I move forward into anything, I'm just gonna go ahead and assess your site. Let me just do hand hygiene again for 20 seconds. Checking your site for any inflammation, swelling, or redness, but I see that it looks pretty fine. Do you feel okay? Okay, great. I see that there are no cracks or leaks in the tubing, and I also see that the chlorhexidine cap is still nice and tight on. We just want to make sure that we check for these specifically, because anything related to air bubbles could possibly mean air embolisms, and of course we don't want that as well. But it looks great. Do you feel okay so far? Perfect. Now that my table has dried for 2 minutes, I'm going to go ahead and take out my kit. I'm going to need my dressing change kit as well as my bio patch. Taking it and putting it right here, and as well as my bio patch, placing it right there. I'm going to carefully not touch the insides, but I am going to fold this paper underneath, and I'm going to be taking out the gloves, and I'm also going to drop my bio patch inside. Perfect. I'm going to dispose of the bio patch, and again, before next step is to do sterile gloves, but I am going to wash my hands for 20 seconds. Do you have any questions so far? Great, thanks for keeping your head to the right. And actually, before I also move forward, I'm just gonna go ahead and check your catheter length. I see right here that it is 12 centimeters, and I also see on the record that it is still 12 centimeters. So looks great. I'm gonna be going and moving forward with the gloves, unwrapping, making sure to only touch the 1-inch border again. You want to make sure not to break sterile field. Great. Going in here, other glove. Putting the cuff over, making sure to fold over the other side as well. Now that we have sterile gloves on, I'm going to dispose of this wrapper right here. Bye. Okay, now that we have our sterile gloves on, we're actually going to be cleaning that dressing. You'll be seeing, I'm gonna go ahead and grab my ChlorPrep right here. So this is actually what we use to clean your dressing. I'm just gonna go ahead and pop it, make sure it's nice and drenched. All right, let's go ahead and start cleaning. So I'm going to be going to hold your tubing with one hand, making sure to keep holding it with this one hand, and doing a 2-inch border for 30 seconds across 2 inches from your site. Are you feeling okay? Great. All right, let's also do the tubing as well. Oh, sorry. Going up. 1, 2, 3, and 4. Perfect. And now that it has been 30 seconds, I'm going to go ahead and dispose of this. And next, I'm going to be going over with my bio patch. Grabbing it right here, making sure to hold it. Actually, before I do that, I'm going to let it air dry for 30 seconds. You feeling okay so far? Great. Make sure to keep looking to your right as well. We're almost done. You're more than halfway through. You're doing great. All right, looks like it's all nice and dry. Let's go ahead and put the bio patch on nice and securely, making sure the blue side is facing up. And I'm gonna go ahead and carefully grab that Tegaderm. Perfect. And then we're gonna go ahead and take the peel with our non-sterile hand, tossing it away. Let's go ahead and place this nice on your chest. All right, we're gonna go ahead and make sure there are no air bubbles. Pressing this in. You feeling okay? Wait, the hardest part is basically done. You were doing great so far. I see that there are no air bubbles, and I'm gonna go ahead and take off the white dressing. All right, now that I don't need sterile anymore, I'm going to go ahead and label this again like the one you had before. We want to make sure we have our initials, date and time on it. Actually, sorry, I want to go ahead and write it down on something. Let me put this back on. Cool. Getting my pen. JP, it is September 21st, 8 p.m. You feeling comfortable so far? That's great to hear. Placing this on the site, but making sure not to put it on any of the tubing. Great. Now since I am all done and we don't have sterile field anymore, you can actually go ahead and turn back so you don't break your neck too much. I'm also going to be getting a little bit of tape just to secure it. Great. And then with this, I see that it's still at 12 centimeters, your catheter. I'll go ahead and document that. I'm going to discard all of this, put it away, another hand hygiene. And I'm going to go ahead and assess and document your sites, your tolerance. And I see that I already did the catheter length, discarded of everything, so we are all good. Thank you so much, Jones. Here is your call light. Let us know if you need anything. Thank you so much.